Angry MGTOW here, and the mental health of women in America is startlingly terrible. Looking at an article that was actually published back in 2010-2011, we can see that women and prescription drugs, 1 in 4 takes mental health meds. And this is, I guess a lot of people shouldn't be surprised, especially men and MGTOW who know the nature of women and know how women behave. It should not come to us as a surprise that so many women are taking drugs for mental health. That there are so many women who need drugs just to be stable and to function on a daily basis. None of this should surprise us. But when you think about the fact that 1 in 4 American women, and this was actually done about 5 years ago, studied 5 years ago, that 1 in 4 American women were on antidepressants or on antipsychotic medication or even on ADHD medication, it's ridiculous. I'm going to link the article in the description. However, something that's shocking is a point that the article makes in regards to ADHD medication being used for women versus men. Typically, they say that men are the ones who need ADHD medication, boys specifically. And the common trend is to give boys ADHD medication. However, the results here are actually surprising. Antidepressants use especially is high among women, up to 29% since 2001. The report showed and anti-anxiety meds are used by women at almost twice the rate seen among men in 2010. 11% of middle-aged women were on an anti-anxiety medication, while only 5.7% of men were on it who are of the similar age. And this article goes back from November 16, 2011. Getting back, there's also a gender shift when it comes to the use of ADHD drugs in adulthood. Although the disorder is thought to afflict primarily young boys, slightly more women use ADHD medications as adults than men. How ridiculous is that? Slightly more women use ADHD medications than men as adults. A lot of men shouldn't be on these drugs in the first place. But even when women are trying to suppress men, even when they were trying to hold us down, they're the ones who are on higher rates of ADHD medication, which stands for Attention Deficit Hyperactivity Disorder. And the use of atypical antipsychotics, medications once mainly prescribed for schizophrenia, have gone up dramatically as well. The number of adults aged 20 to 64 taking these meds is 3.5 times higher than it was in 2001. And although the number of men on these drugs increased more dramatically during that time, there are still more women than men taking the medications. There are more women taking antipsychotic drugs than men. Antipsychotic. Dr. David Muzina, a psychiatrist and national practice leader of the Medical Neuroscience Therapeutic Resource Center, actually spoke with the Huffington Post back in 2011 and explained some of these results a little bit better. So 1 in 4 women is on antidepressants, and women are using or at least prescribed these medications at higher rates than men. Why is this happening? Well, here's what he has to say. In general, we know that women tend to seek treatment and go to doctor's offices more frequently than men do. When you move into the behavioral health space, that may even be more true. So the opportunity to get evaluated and diagnosed and treated is likely higher. That may, to some extent, explain some of the differences. We also believe that women may be at higher risk for major depressive disorders. It is likely biological. We don't know exactly why. This is coming from a psychiatrist. I can speak from experience as a practicing psychiatrist compared